To begin phase 3, abdominal curl up, lie on your back. Bring your hands up towards the head so that the fingers are lightly touching the ears. Tilt the pelvis to flatten the back. Raise the shoulder from the surface. As you perform the curl up, hold the head still. Do not flex the neck and avoid bringing your chin towards your chest. Make sure the movement is smooth and consistent on the way up as well as on the return down. Level 3 lower abdominal strengthening begins with lying on your back. Tilt the pelvis as you tuck in the stomach to flatten your lower back. Maintain this position as you again bring your legs up into the 90-degree angle. Lower one leg down slightly to keep the heels suspended in the air. Slowly extend the leg out. Return the leg back to the starting position. Repeat other leg. Continue to alternate back and forth. It is extremely important to maintain the pelvic tilt and keep the back flat while doing the leg movement. Make sure the movement is smooth and consistent. To perform Corman planks for abdominal strengthening, begin by lying on your side with the elbow tucked in underneath you. You may place the top hand on top of the hip. Raise the trunk and hips up off of the floor so the body is straight and in line. Hold this position while contracting the abdominals. Do not let the body twist. Perform this exercise both on the left side as well as the right side. Lie on your back with your elbows tucked underneath you. Raise the hips and trunk up off the floor so the body is straight and in alignment while contracting the abdominal muscles. It is important to maintain the trunk, such as a straight board or plank, and not let the back sag. Begin by lying on the floor on your stomach. Tuck the elbows in underneath you. Keep the legs in line with the trunk and lift the hips up off of the floor so the body is straight in alignment. Contract the abdominals and hold this position. It is important to try to make the trunk like a straight plank rather than arching. The dying bug exercise for abdominal strengthening begins lying on your back. Tilt the pelvis as you tuck in the stomach to flatten your lower back. Maintain this position as you bring the legs up to a 90-degree angle and arms overhead so hands are pointing towards the ceiling with the elbows straight. Hold this while slowly lowering your left leg down to allow the heel to touch the floor while you bring the right arm backward. Return the leg and arm to the starting position. Slowly lower the right leg down to touch the heel to the floor while you bring the left arm back. Continue to alternate back and forth. It is important to maintain the pelvic tilt and keep the lower back flat while performing the movement. Make sure the movement is smooth and consistent. To perform bridging with straight leg raise, begin by lying on your back. With the legs bent, contract buttocks muscles and raise the buttocks from the surface. Hold this position and slowly extend the right knee out straight. Then return the leg down by slowly bending the knee so the foot is in contact with the surface. Slowly extend the other knee. Slowly bend the knee. Then lower the buttocks. Relax the buttocks muscles once the buttocks contact with the surface. It is important to do each step separately. Make sure the thighs are even as you do this and do not raise the leg up while keeping the buttocks in the air. Alternating arm and leg lifts, strengthening begins in the kneeling position. Slowly extend the right knee as you lift the right leg backwards as you raise the left arm in front. Repeat the same exercise, raising the left leg and the right arm. Alternate. This is an opposite arm and leg movement, meaning as you lift the right leg, you lift the left arm. Slowly lower both at the same time. The higher the leg is lifted, the more challenging the exercise. If it is too difficult to lift it all the way out, then only raise the leg part of the way. Do not arch or rotate your back or your neck. Be sure to keep the abdominals contracted during the entire movement and your back straight.
Check with your doctor or therapist before performing any exercises or stretching to be sure these exercises are within your ability. Be sure to understand the correct technique before performing any exercises. Should you experience any pain while performing any exercise, stop immediately.